This video is my method for Botox for people with pain, both acute and chronic pain. It is something of a true revolution. I'm probably the only one in the world really doing this because I invented it, and I've tried to electron it. In fact, I'll be electron it in Las Vegas in a couple of months or a few months, October, what is that, 3 or 4 months from now. But it's something I'm very proud of because I really believe I've changed a lot of people's lives out there. And I want to talk to you about how I do it, what to expect with it, what the limitations, the risks, etc. of this treatment. So I'll tell you a very brief history of how I found this out. 17, 18 years ago, I had a lady that I did a facelift on, had a lot of pain in the back of her ear. That's the greater auricular nerve distribution. I tried everything to manage the pain. Nothing really worked, from lidocaine to marcaine, steroids, and I put a little Botox in it, and the pain went away, never came back. And I realized, wow, this is a gem. I had some gentlemen that had hair transplants with scars back here from done, I hate to say, in India, with nerve damage, chronic neuromas, pain, paresthesias. And I said, let me try some Botox in them. So I tried some Botox, and within 1 second, that pain was gone. It started coming back at 3 or 4 months, and after 5 rounds, they never had pain again. I actually extinguished their neuroma, which is so crazy. If you ask your physician, they would say, no, Dr. Lamb's making up some nonsense. There's no way that works. And it absolutely worked, and they're now pain-free. Now, it did not get rid of their numbness. Their nerve is damaged. I've never created that in 20 years of doing hair transplants, but it is something that is very interesting in terms of managing chronic nerve issues. So what are things that, how does this work? I have a whole different video just on migraines, which it works incredibly well on migraines, carpal tunnel, etc. We'll sort of hit upon these points. I first want to talk philosophically what I'm doing, and of course the limitations of this. So the treatment for pain therapy is really managing the specific pain itself. And what's interesting with this is that Botox is something that you think, well, how long does it take to work? I get Botox for wrinkles. It takes me about half a day to 2 days to see the difference. It gets a little bit better over a week. With this, the pain reduction is instantaneous. You will feel an immediate reduction in pain. If you do not feel reduction in pain immediately, I have not hit the right place. In fact, who else is being treated? I am. I just had my TMJ done. There's a great video I just shot today on TMJ, specifically using the same technique for that one incidence. I'm talking general concepts of pain control, where I do it, when I don't do it, where I don't get much result on, and where I do get results on it. So TMJ is a great example. It is not the traditional TMJ treatment where you're just injecting the master, which I also do to slim the face, but for pain control, I use a very specific method. So migraine, you can listen to my video on migraine. I shot that a few years ago. I don't think there's a lot outdated with it, but I do treat it very differently. So the way that I treat migraines and different types of pain, I liken it to a sniper killing an enemy. I'll talk about migraines specifically in a little, it's just as a prefatory comment, because it's the one area that people do use Botox for pain, and I really believe they do it incorrectly. So if you're saying, well, I've had Botox for pain, it simply doesn't work. I treat my migraines. I don't get much difference. And you say, well, the standard answer is always, I'm getting 200 to 300 units. I'm getting 2 to 3 bottles of Botox into my scalp. And you're saying, Dr. Lang, how many bottles are you using? Believe it or not, I'm only using maybe like a few units. And you say, well, wait a second. So you're saying in 3 units, you're getting a better result than someone with 300 units, 100 times the number? Absolutely. The phrase I use, or the way analogy is, if you've got a guy that wants to kill the enemy, what the neurologist is doing is like someone blindfolded in the dark 5 miles away with an assault weapon shooting everywhere and in the breeze, and they may hit you. But what I do is, like, I have a gun. Sorry, this is not talking about gun control or anything. I'm just using this analogy. And the enemy's right there. I have the gun right to the forehead, and it's gone. So I am hitting the problem, and it doesn't take a lot of units. It's all targeted therapy. So it's a sniper injection rather than a grape shot attack from 5 miles away blindfolded. So I get instant reduction. It almost makes no sense because Botox, for anything, takes hours to days to work. And I just literally, a couple weeks ago, was in San Diego. I walked into a lecture by accident, listening to something about mechanisms of Botox, because I went back and looked at some old book I had on all the basic science on Botox, and I literally couldn't find anything about this. the thinking is there may be something called transcytosis. Trans meaning through or across. Cytosis is cyto means cell. So I believe that there's a penetration, an infusion through the cell membrane of the Botox into the nerve issue for improvement. So migraines, when I treat it, I can take a visual aura and wipe it out. I can take a migraine, wipe it out. My staff member comes in sometimes with acute migraines and before a hair transplant, and I'm not even worried about it because I know she's going to perform, because within a few units, the migraine is gone, and it's instantaneously. Courtney, who works in my front, had a migraine that lasted 2 days, and I'm shocked because she works my front desk that she doesn't know I can treat it. And with instant improvement, she was on Tylenol around the clock trying to get it treated. I put in a couple drops and her migraine was instantly wiped away. So if you're having chronic pain, you go, but that's not the time to see Dr. Lamb. No, come in now and see me, because if you're in pain, I should be able to instantly manage it. So what are the types of pain therapies I've treated? Well, I've already mentioned a few of them, which is TMJ pain, temporomandibular joint pain, that is, migraines, any kind of pain in the neck or in the shoulder area. I had frozen shoulder. I don't think with a frozen shoulder it's very treatable. I have done finger pain. My staff, Al, I inject his fingers. Carpal tunnel, I've taken carpal tunnel and it almost instantly reversed it. And I've taken plantar fasciitis and knocked that out pretty quickly. I've managed a lady that's a professional ballroom dancer. I had done her facelift and she had chronic nerve pain in that area. I managed that as well pretty instantaneously. So I'm able to treat a lot of diverse area. My mom, she's 80-some years old. She had chronic knee pain. I injected her knee a year ago. She still is pain-free from her knee after one treatment. So it's very powerful to treat these areas. What are the limitations of this? First of all, of course, I can't guarantee I'm going to knock out your pain. The second thing to understand is I'm not treating an underlying pathology. So if you need a knee replacement, if you need shoulder surgery, clearly I'm not treating that. I'm not helping you with that, but I'm treating the pain. So please understand that because I've treated the pain doesn't mean you can go out there and now jump, long distance high jumping or whatever. I'm just treating the pain. Always have your doctor manage the pain. Where are areas that I don't get much success? Usually it's sort of central back, like if you're talking about slip disc, central zones, big hip areas, although I've treated my cleaning lady with this area and she's gotten good results with that. But in general, large central areas, I don't get as good a durable result on, but anything peripheral or central on the neck, shoulders, I get really good results on it. It's instant improvement. Very, very different method of treatment where I'm actually eliciting pain with the injection that causes an instant reduction. So it's a very unusual way of treating it. How often do I need, so how much relief should I get? My goal is 100% relief. I can't guarantee that I'm going to manage the acute or chronic pain, but it's very, very powerful. If it's post-surgical, of course, if I'm not the one that did your surgery, I can but I treat it. If I have a patient with otoplasty, if they've got some discomfort in the contralateral bowl, I put a drop in there, that pain is wiped out and usually does not come back. But some patients, after I've treated, they say, well, I've got more pain here and there. The reason they have more pain is actually I manage 80% of the pain. And that 20% that I did not manage, they're now feeling it, and I just treat that area. So that is something that I don't charge for a touch-up if it's within a week or two. I just treat it. The natural question is, is how long will this last? If it's really a severe pain, of course, make sure your doctor is approving this, to make sure that you don't have some underlying pathology. But usually, if it's really bad pain, it may last 6 weeks to 2.5 months. For my normal pain, it's 3 to 6 months. I usually encourage you to come back at 3 months for me to treat it again. And then usually, if at 3 months, if you're coming back and the pain is a lot better but not quite gone, I probably will keep you at 3 months. And the next time, if I treat it and it feels like, oh my God, it's so much better, I barely need you, I'll go to 4 to 6 months. My goal is to lengthen that interval the best of my ability. Not everyone can have that goal lengthened, but oftentimes I'm very confident. As I told you, I've treated chronic nerve damage and was able to manage this. So I'm very confident I should be able to start lengthening you up toward 4 months, 6 months, maybe 9 months to a year, maybe once a year. But I know if you're in chronic pain or having acute pain, if you sort of fit this bill, I'm very happy to help at least improve you and in terms of therapy. So these are some concepts that I have toward pain management. It's something very novel, a natural question people always ask, why haven't I heard of this? Why isn't some other? I invented it. If I've invented some technique, Of course, most people don't know about it. I've done my best. I published a recent book that's coming out of published lecture journals. Things have been published in journals. I am lecturing on this. Unfortunately, most doctors still don't get this. And also the technique, just like anything, I do this several times a day for years now, and I've developed a better technique of sense of how to do this. And so even the doctors that are learning this, they're just not skilled at understanding how to deliver it yet. It takes years of practicing this to really understand how to manage chronic pain. I have an intuition of where to go and how to treat it. So hopefully, if you have chronic or acute pain and you want something that I can improve on, this is a therapy that I've developed that has really managed my patients in very significant ways.